Excellency Li Kuan, Vice Minister, National Health and Family Planning Commission, China, His Excellency Dmitry Kostenikovo, Honorable Deputy Minister of Health Care of the Russian Federation, His Excellency Dr. J. Fala, Honorable Deputy Minister of Health, South Africa, Mr. Shripad Yesonayak, Honorable Minister of State for Ayush, Government of India, Head of the Delegation from Brazil, Fabio Federico, Dr. Poonam Khetrapal Singh, Regional Director, WHO Sierra, Dr. Flavia Bistrio, Assistant Director General, WHO, Dr. Henk Pekedem, WHO Representative to India, Dr. Luis Loras, Deputy Executive Director of Program, UNAIDS, and Assistant Secretary General, UN, Mr. Yaron Wallman, Chief of the Health UNICEF India Office, India Director UNFPA, India Director UNAIDS, distinguished delegates from Brazil, China, Russia, and South Africa, colleagues from the Ministry of Health and Family Welfare, and colleagues from the Ministry of Ayush, Government of India, distinguished participants, invitees, ladies and gentlemen. At the outset, I would like to wish all of you a very happy and a prosperous Christmas and a new year in advance. On my and my ministry behalf, it gives me immense pleasure to extend a very warm welcome to all of you in New Delhi. It is India's privilege to host the 6th BRICS Health Ministers meeting at New Delhi, and we are grateful to you, Excellencies, for having accepted our invitation and traveling all the way to India. India had the honor to host the 2nd BRICS Health Ministers meeting in January 2013, where we had suggested to institutionalize the BRICS Health Ministers platform by agreeing to meet at least once a year to reap maximum benefit out of this platform. I am happy to note that we have kept that promise and have been meeting on a regular basis, not only through a formal meetings once in a year, but also on the sidelines of the World Health Assemblies every year. This shows that we are together on a collective path. We stand strong in unity and we are committed to our friendship. Despite our diverse geographical and climatic backgrounds, we share the same challenges in the domain of public health. As health ministers representing about 43% of the world's population, our joining hands gives a collective expression to global public health aspirations. I am happy to note, therefore, that the BRICS platform has gained from strength to strength, assumed global recognition, and helped us to address challenging global health issues with solid unity. Today, we are delighted to continue the good work started on the historic occasion in Beijing on 11th July 2011, which marked the coming together on a common platform of health leaders from 4 different continents. We had made a commitment to collaborate to advance access to public health services and goods in our own countries and deliver the most cost-effective, equitable, and substantial solutions for common health challenges. At the same time, we had also expressed commitment to support other countries in their efforts to promote health for all. Our efforts have found support from our heads of state, our governments. We are happy to acknowledge of the renewed commitment to health by the BRICS leaders as expressed in the Goa Declaration of October 2016. Thanks to technological innovations and communication revolution, the world today has virtually become an interdependent global village where we are learning from each other and are benefiting from the best practices and advancements made in dealing with common health goals and challenges. Although we have been able to make significant progress in providing better health facilities to our people, we recognize that much more still needs to be done. BRICS gives us a very important platform to be able to do that in an environment of mutual trust and cooperation. During the journey together, we have identified specific areas of work and collaborative action plans under the BRICS Health Platform. We have since progressed to expand our areas of work into a BRICS framework for collaboration on strategic projects in health. I am happy to note yesterday, that is on 15 December 2016, senior officers and advisors from the delegations met and discussed threadbare the concrete agenda to carry our work forward. Excellencies, I am happy to be fondly recall the declarations jointly issued by BRICS health ministers and member states meetings in Beijing, Delhi, Cape Town, Brasilia, Moscow and Geneva. These joint statements are our pillars of strength and a guide to our future work together. Excellencies, as you know, India, with its size of population, the geoclimatical, socio-economic diversities, presents a great public health since 1990. The new HIV infection among adult population has declined by 57%. Substantial reductions have been achieved in incidence and mortality from major infectious diseases such as tuberculosis, malaria, pneumonia, and diarrheal diseases. In 2016, India celebrated 5 years since the last case of wild polio was reported. WHO headquarters confirmed India's claim of yaws-free status in 2016. WHO has validated the elimination of maternal and neonatal tetanus in 2015 from India. Cases of Kala-Azar declined by 11% in 2015 from 2014 and 78% since 2006. Leprosy has been eliminated in 84% of all districts. We are, however, aware of the inequities in access to health services and health outcomes. India's large, diverse population is a formidable challenge. We are grappling with shortage of health workforce. We are facing the rise of non-communicable diseases. Despite these challenges, India is poised to carry forward the momentum of progress made during the MDG period into the 2030 Agenda of Sustainable Development. To do so, we have already taken some key initiatives. The National Health Mission in India has been a success story. It is working to develop sustainable health systems, enhance quality of human resource for health, improve infrastructure at the primary and secondary levels, and reduce out-of-pocket expenses. We are working on the new health policy. The India Newborn Action Plan is India's commitment response to the global Every Newborn Action Plan. Mission Indradhanush was launched with an aim to further strengthen the routine immunization. We have launched a national campaign named Beti Bachao, Beti Padhao, that is save and educate the girl child in 161 gender critical districts. We have initiated strategic nutrition related interventions also, such as promotion of infant and young child feeding practices and establishment of nutritional rehabilitation centers. A new campaign has been launched to promote breastfeeding practices for children. India was among the first countries to approve and adopt the National Multi-Sectoral Action Plan from the prevention and control of NCDs. We have shown leadership in tobacco control, including implementation of WHO FCTC. We have successfully implemented the new rules on pictorial health warnings, mandating that such warnings should be printed on 85% of principal display area of tobacco product packs on both sides. We have achieved compliance with the core capacities outlined in the International Health Regulations 2005. India is committed to developing a national action plan to containment of AMR and overseeing its implementation. Steps have been taken for system strengthening of public health facilities. Quality standards for district hospitals and primary health centers under National Quality Assurance Framework have been rolled out. Excellencies, faced with the common new health challenges, we must rise to the occasion with specific plans of collaboration to harness our strengths and overcome our weaknesses. Here I would like to briefly highlight some of the important areas where we could all gain by mutual collaboration. The threat of non-communicable disease is dangerous for our countries since they not only result in premature deaths and disabilities, but are also responsible for low productivity, losses in economic growth, and high healthcare costs. NCDs are also a major barrier to the achievement of sustainable development goals relating to reduction in poverty, improvement of maternal and child mortality, well as the control of AIDS, tuberculosis, and malaria. We must therefore renew our resolve and commitment to fight NCDs together on the BRICS platform through innovative strategies. Excellencies, ladies and gentlemen, a major public health concern for the BRICS countries is tuberculosis, including multi-drug resistant tuberculosis, due to its high prevalence and incidence. Another area requiring urgent attention is HIV/AIDS. I am happy to note, therefore, that the BRICS workshop on HIV and tuberculosis held in Ahmedabad, India in November 2016 highlighted and identified the political, technical, and financial actions needed to address the public health challenge of tuberculosis and HIV among BRICS countries. I would urge adoption of the TB cooperation plan in this background. I would also urge that we agree to create a research consortium on TB, HIV/AIDS, and malaria. As a group, we must also support convening a UN high-level meeting on tuberculosis at United Nations headquarters within the overall framework of universal health coverage and the 2030 Agenda for Sustainable Development. Excellencies, an effective health and disease surveillance is a must for achieving a sustainable victory over the disease burden, both communicable and non-communicable. For this purpose, we must recognize the need to build our capacity for effective health and disease surveillance systems and to move forward for institutionalized coordination between BRICS countries. I am happy to note that the BRICS workshop on strengthening health surveillance system and best practices hosted by India in August 2016 at Bengaluru, India has made recommendations to work together on strengthening our health surveillance systems. We must support, therefore, the recommendations that emerged out of the deliberations during the BRICS workshop under the theme. The world is grappling with the challenge of affordable access to technologies, both medicines and diagnostics. Trade regimes are important, but must be seen as subservient to shared international public health goals. Affordable medicines are no longer necessary for poor countries alone. Regulatory capacities need to be strengthened to enforce appropriate quality standards and check the entry of spurious medicines. I am happy to note that in BRICS workshop on drugs and medical devices in Goa, India in November 2016, the BRICS regulators agreed on a draft MOU on regulatory collaboration with a view to improving the standards, certification, and regulatory mechanisms for drugs and pharmaceuticals and promoting availability of safe, efficacious, affordable, and quality medicines. Let us move forward by agreeing to sign the MOU and constituting a regulatory work group to work on mutual recognition, sharing of information, accelerated regulatory approvals in the case of international and national health emergencies, promotion of innovation and R&D, including adaptation through technology transfer of innovative medical products, creation of an IT platform, and regulatory capacity building through an institutional development plan for BRICS countries. We must recognize at the same time that to have sustainable results, such as action to go hand in hand with measures aimed at improving access to affordable and quality medicines. Excellencies, I am happy to inform you that WHO member state mechanism in relation to working definitions of SSFFC medical products in particular arrived at a consensus on deleting the word counterfeit, as it usually refers to intellectual property violations, and on excluding any consideration of the patent's trademark or other IP issues while defining falsified medical products. This, I believe, would go a long way importing access to medicine, including through a full use of TRIPS flexibilities and defending our policy space against TRIPS, plus provisions and other measures that impede access to medicines. Such measures are necessary not only for BRICS but for the entire world. Excellencies, Indian generic drugs have helped in bringing down the cost of treatment of various diseases globally. I believe that tremendous scope exists in collaboration and better coordination of research and financing of new drugs among the BRICS countries. We can increase our capacity for research and development of innovative medicines, especially for neglected diseases, to help promote access to affordable medicines and to reduce dependence on technology transfer from developed countries. Antimicrobial resistance is a serious global public health issue. There is a pressing need to implement the WHO Global Action Plan on AMR. However, while doing so, we must draw attention of the world to the need of addressing issues of equity, affordability, and sustainable access to existing and new antimicrobials, as well as mobilizing necessary technical and financial resources for implementation. There have been suggestions from some quarters about a market financing mechanism to promote R&D on new antibiotics. However, we would suggest that new approaches to research, product development, and innovation should be first discussed in a multilateral forum like WHO. Innovation models must ensure affordability of new antibiotics by delinking their price from the cost of R&D and through careful drafting of the product development partnership. We also need to ensure availability of new antibiotics to those who need them. In all the countries, we are of the view, therefore, that any restrictive marketing practices for new antibiotics must be discouraged. There can be no healthcare without health workers. Each one of us certainly realizes this cardinal principle. Each one of us, in some way or the other, is working towards enhancing the availability of human resources for health. We must, therefore, aim at expanding and extending cooperation amongst the BRICS countries for capacity development of human resources in public health and clinical medicine. In this context, we welcome the recommendations of the UN High-Level Commission on Health, Employment and Economic Growth and look forward to development of an implementation plan to amplify gains across the 2030 agenda for sustainable development and with a view to delivering universal health coverage. We must acknowledge the need for greater use of information and communication technology in health services to promote cost-effective treatment as well as better maintenance and use of data for surveillance and policy formulation. Let us strengthen our cooperation to share experiences in e-health, m-health, and e-governance. As always, we stand fully committed to our support for further development of a fully functional global observatory and health and R&D for the implementation and financing of all the selected demonstration projects. It is in the interest of the developing countries to ensure that the priority setting and financing mechanism on health R&D covers the full scope of disease mentioned in the CEWG's report, including all type 2 and 3 diseases and specific R&D needs of developing countries relating to type 1 diseases, while upholding the guiding principles of the delinkage of the cost of research and development from the price of health products. Excellencies, ladies and gentlemen, the world needs a strong and competent international organization such as WHO to deliver the international health cooperation and provide technical help to nations. In view of WHO continues to play a major role in the promotion of access to medication, technology transfer, and capacity building toward bridging more equity to the health sector worldwide. Let me express my gratitude to Dr. Flavia Bistrio, Assistant Director General WHO, for having traveled to New Delhi and for having given us encouraging message from WHO to carry our collective public health agenda forward. I would also like to commend in particular Dr. Margaret Chan, DG, WHO, for her leadership of the WHO. She has been very ably building an environment of mutual cooperation and assistance to combat public health challenges with increasing cross-border ramifications. I would like to thank Dr. Michael Sidby, ED of UNAIDS, for nominating Dr. Louis Lauros, Deputy Executive Director, UNAIDS, to represent him at this meeting. I thank Dr. Louis for taking time out to be with us here today and highlighting the progress made in our fight against HIV/AIDS, a very important area of cooperation amongst us. Our partnership with the UNFPA and UNICEF has been instrumental in handling our strategy on population matters and in policy and programmatic interventions on maternal, child, and adolescent health, and we are thankful to them for their support. Before I conclude, I'd like to thank all of you once again and would like to reiterate India's commitment to work together with our friends and partners, Brazil, China, Russia, and South Africa, towards a world free from disease, a world full of health and happiness. Let us continue to work together for common benefit and benefit of the world at large. Let us remember the famous quotes from Publius Cyrus, who said, "Where there is unity, there is always victory." And from J. Rowling, who said, "We are only strong as we are united, and as weak as we are divided." Let us always remember these words when guiding ourselves to work together on BRICS platform. Thank you for your kind attention. Thank you very much.